If you have been watching my YouTube channel for a while, you probably have noticed I chat a lot about urinary issues in cats, and for good reason. It's one of the most common problems I see in practice, sometimes multiple times a day. But every now and then we hit a wall. We've done all the tests, urine test, blood work, imaging, and they all come back normal. We've made all the correct litter box changes, and your cat still is not using the litter box 100% of the time. At this point, we are likely dealing with a behavioral issue, and that's when I start talking about medications. There are some other options: pheromone diffusers, calming diets, nutraceuticals. They can help, but chances are, if you're watching this, you're frustrated and you want something that works now. That's where fluoxetine comes in. You may know it by its brand name, Prozac. I most often use it for cats that are peeing outside the litter box. However, it can be used for other behavioral issues: marking, spraying, anxiety, and even aggression. Just like with any medication, there are some side effects. The most common ones I see are being a little sleepy, low energy, lethargy, and a decreased appetite, especially in the first few days. Usually these settle down on their own. If not, we adjust the dose. Some cats may experience vomiting, diarrhea, and nausea. Rarely, it can cause aggression and even seizures. Fluoxetine is not for every cat and should be used with caution in cats that have diabetes, kidney disease, or liver disease. It can also interact with other medications, including flea collars, and these will be discussed with your vet before starting the medication. Every cat responds a little differently to this medication. Here's my approach. I start with a middle-of-the-road dose based on your cat's weight. Give it a good 2 weeks and then reevaluate. In some cats, we see improvements after just a few days. After the initial 2 weeks, I may make an adjustment to the dose based on your cat's behavior in the home. In my experience, cats on fluoxetine fall into one of two groups. The first group are my long-term users. These cats require fluoxetine daily over a long period of time. The goal here is to find the lowest effective dose. The second group are my short-term users. They improve on the medication after a few months, we taper down, and eventually we get them off fluoxetine for good. Which group is your cat in? Only time will tell. Fluoxetine comes as a tablet or a capsule. If you have a hard time peeling your cat, depending on the medication's release formulation, you may be able to crush the tablet or open the capsule and mix the powder in canned food. But let's be real, cats are cats. You may have to get this medication compounded into a flavored liquid or a chewable treat. One form I don't recommend is transdermal fluoxetine, the type you rub on the inside of your cat's ear. If it sounds too good to be true, sometimes it is. Studies say only 10% of the medication is absorbed when compared to oral formulations. So if your cat is not responding and they're on transdermal fluoxetine, it may not be getting absorbed and can't do its job. Links to those studies are in the description. One word of caution: don't stop this medication abruptly. If you want to stop it, talk with your veterinarian on how to safely taper this medication. Another word of caution: make sure you've ruled out a medical issue first. Fluoxetine can't fix the issue if your cat has crystals, stones, a urinary tract infection, or another urinary issue. Always investigate the medical side thoroughly before saying it's behavioral. There are other behavioral meds out there, but in my experience, fluoxetine offers the best balance between effectiveness and minimal side effects. If you want to take a deeper dive into cat urinary issues, and that can be with crystals, urinary tract infections, FIC, inappropriate urination, diet tips, or litter box hacks, then check out the video links in the description. If you learned something, make sure you like, subscribe, and comment. Thanks so much for watching, and I'll see you on my next video.